If you have cervicogenic headaches, cervicogenic vertigo, or dizziness, then you need to stop stretching your neck. In today's video, I'm going to show you exactly why you need to stop stretching your neck, and more importantly, 3 exercises that you should try today in order to stabilize your neck and actually start fixing the problem. I'm Dr. Posa, and I'm a corrective care chiropractor in Milton, Ontario, Canada. I help people with their spine-related health concerns so they can live the life they are designed to live. So if you like this content and want to see more, subscribe to my page, and more importantly, share this information with somebody you know needs to hear it. There are a ton of videos out there that show people how to stretch your neck, how to get relief. However, this could be destabilizing your spine. What does that mean? It means that your spine is actually becoming weaker, and the source of the problem is coming from your spine. And so one of the most common things that people do the moment they feel neck pain, maybe they're getting the dizziness, the vertigo that comes on, or even the headaches, is you want to stretch it out. You want to pull on your neck. You want to take pressure off the muscle. And that is inherent. You feel like you need to do it in order to get relief. However, in most cases, the problem is that there is a misalignment in your spine that is destabilizing your spine, causing other muscles to work harder, hence why you want to stretch. And so what we need to do is we need to show you 3 different exercises that you should try today in order to actually start stabilizing your neck, make it stronger, and that way the next step after that would be simply to make sure that the alignment is right. And that would mean just going into a corrective care chiropractor, get your exam, get an x-ray, check the area, and make sure that the alignment is right. Because if the building is off, you can work on all the muscles all you want. You need to stabilize the building. So the first exercise that we're going to do is something called the deep neck flexors. Now, why are we focusing on this? It's quite simple. In fact, some of you are going to notice that when you look at your posture, so let's say you're looking in the mirror, you see yourself from the side or somebody else is commenting. When these muscles are weak, the deep neck flexors, what happens is your posture will start to come forward. You're going to get that chin out and forward. Your posture is also coming forward because these muscles aren't doing their job to retract your spine. So if you're noticing your spine is rounding, you are going forward. Deep neck flexors are most likely weak. People who are at their desk a lot, people who are driving a lot, anybody who's using a lot of technology, students who are studying constantly, their head is down. There's so many reasons these days that these muscles become deactivated. So now what we need to do is learn how to reactivate these. So I do have a very simple exercise that you want to do. And all we're going to do is we're going to use neurology behind this. So we're using the connection with the eyes and the back muscles here, as well as these deep neck flexors here. So it's a bit of a combination exercise, but it's excellent to take the pressure off. So most of the people with vertigo, dizziness, like I said, problems with headaches or even migraines, and even jaw issues, problems in and around the face, it can really help take the pressure off because a lot of the times it's the nerves that come out of this part of your spine that's damaged. So here's the exercise. You're going to draw yourself back. So you can do this sitting or standing. And all you want to do with your neck and your eyes is you want to start looking down. So I'm going to be pointing my head down slightly. Then I'm going to draw my head backwards as I look up. So I would find something on the wall, maybe just something, a picture frame, something you have on the wall. And what you're going to do is you're going to look with your eyes, and then you're going to stabilize this way. So we're coming back. I'll do it from the side. So I'm looking at a fixed point on the wall. I'm using my eyes, and I'm bringing myself backwards. Now, when I'm bringing myself backwards, what I should feel, or what you should feel, is not necessarily here you should feel it, but you should actually feel it between your shoulder blades. You should feel like these muscles are working because it's the deep neck flexors that are deep in here that are pulling back. And as that's pulling back, these areas are releasing a little bit, because when you do have this forward posture, this clinching here, you'll notice this area actually gets pinched. And so those bones that are in your neck are literally pinching. They're getting stressed out, and there's nerves that come out of there. And these are the nerves, the greater and lesser occipital nerve, that go around your head. So if you're getting the headaches, you're getting the migraines, you're getting the vertigo, the dizziness, this is an excellent source of why you're getting it. And so stretching out that area that's already weak doesn't make any sense. Repeat that exercise 10 to 15 times. Nice, slow, hold for a couple seconds and letting go. Again, 10 to 15 times. If you could do 15, it's a little bit better because now we're working on some of the postural muscles, which the more you can hold these muscles, the slower the contraction, the better it'll be for them. This next exercise I'm going to show you is going to use a tabletop. So if you have a counter, you can do this on your counter at home. This one's a little bit higher because we're at the office here, but it's pretty simple. You're going to lay your forearms on your tabletop. And then from here, I want you to adopt a stooped posture. So you're actually going to be coming forward like this. Now from this position, what you want to do is do two things. Again, you want to use neurology, which is using your eyes. And what you want to do is you want to pull yourself back. But as you pull yourself back, then the next step, step 2, would be to start looking up. And again, you're looking straight. I don't want you looking up. It's got to be a straight gaze. So again, something in front of you that you want to end up looking at. But the first stage is not to look up and then pull back. It's a pulling back and then looking up. Hold that for a few seconds and then let go. So, and then when you're letting go, don't just like flop down or something, then you're really going to hurt your neck. So it's very simple. It's down, starting in this position, pulling back, and then looking up. Hold for 2 seconds and drop. Again, you're doing this for about 10 to 15 reps. The next progression above that would be to bring your hands behind your neck like so. So you're going to put it behind your head. Your elbows are going to be forward like so. And all you're going to do is push backwards. So I'm pushing into my hands. Again, I should feel in between my shoulder blades, you should feel those muscles acting. So now what we're doing is we're stabilizing the back neck extensor muscles. Again, and what a lot of people are going to notice is you start doing these exercises, your posture will start to improve. Not only do some of the symptoms go away, but then you can actually be, let's say driving, you can look over your shoulder and not worry that you might throw yourself off. Some people just driving, they quickly look. It can actually stimulate a lot of things, including the dizziness, vertigo, headaches, and all kinds of shoulder pains and things like that. So stabilizing this is a great way to prevent those things. Now the last muscle that we want to be attacking is the muscle that is typically going to be overcompensating, which is going to be causing a lot of problem. And now this muscle is called the Levator scapulae, and it runs on either side of your neck, and it comes all the way down, and it attaches at the top end of your scapula. So what happens is this muscle overcompensates because your head is coming forward, it's pulling on the neck, and this muscle has a lot of pain fibers inside of them. So this one, you can not only get those knots in the back of the shoulder, you'll feel it between your shoulder blades. It comes all the way up your head. It can cause headaches, it can cause vertigo. It slams, when these guys get really tight, it slams your skull down because it's pulling on all that area. So this is another muscle that most people are going to want to stretch. However, it's attached to the scapula, which means the two back plates behind your shoulder blades, this area right here in your spine, on the side of your spine, those areas sometimes are weak. They're not doing their job properly. And so again, other muscles are overcompensating for it. So what we want to do is stabilize your scapula. So this one can be done a few different ways. The first starting position, or the easiest starting position, would be just to bring out your hands in front of you like so. Now some people with a lot of shoulder problems might find this one more difficult. However, in this case, all you want to do is bring your shoulders back. Hold that for a few seconds and let go. I'll do that from the side. So again, you're bringing your arms out in front like this. I'm almost rounding my back, so you're getting a bit of a stretch this way, but then it's a pull back. Now when I do that, you'll feel like your chest wants to come forward, and if you do this properly, you should feel like your back is coming inwards. And as it comes in, you're holding your scap together. So your back muscles or the back scapula should come in like so. So they're usually out like this. You should feel them come in, or what we call kissing scapula. So we want to bring them in. So that's all you're doing, is you're bringing them in, holding that position, 2, 3, 4, 5, and then relax. Again, squeeze, 1, 2, 3, 4, 5, and relax. You can repeat that about 10 times. That'll be a nice workout for most of you. The next progression after that, if you really start to see those results, then you can use a stretchy band. So in this case, I have the red stretchy band, which is only about 5 pounds of pressure. It's not too much pressure. But now what we're doing is we're pulling apart and driving backwards. So we're doing both. I'm pulling this way and back between my shoulder blades. So the exercise would look like this as I pull back. Hard to see sometimes with the shirt on, but as you're pushing your arms out, you're drawing back, just like in that first move, and you're holding that for about 5 seconds and then letting go. The 5-second hold is a really good way to really stimulate, but also not create too much other tension with the other muscles. We're really trying to focus in on those muscles to get you the quickest relief possible. Please try those exercises and let me know down in the comments below how it worked for you. Let me know what worked, maybe what didn't work. If you have any questions about this video, leave it down in the comments below. And if you found this video to be helpful, please give it a thumbs up, subscribe to my page for more great content, and don't forget to share this with somebody you know needs it.